Right, let's talk about sciatica. Let's talk about sciatica. So, sciatica is the inflammation or the pain that people get around the buttock area, the lower back and the buttock area, and it travels down the back of your legs. Now, the sciatic nerve is the biggest nerve in your body, okay? And as I said, it's going from your lower back all the way down to your feet. So it's a massive, long nerve. When that nerve is irritated, and it's usually due to the wrong posture, generally, or some sort of brisk movement of your body, especially from a sit-in position, trying to get up too quick. That's one of the risk factors. But when that pain happens, it can be a terrible pain. And it could start just from a tiny little bit of a niggle, and that's all. And then over a couple of days, it becomes a horrendous, unbearable pain. If you get sciatica, which is generally on one side, which means it travels down your left side, from your buttock all the way down, and it doesn't have to be all the way down to your feet. It can actually just sit around your buttock area and be some ridiculous pain there. But also it can travel down the back of your thigh to your knee. Sometimes it goes all the way further down your legs or to your foot. Well, when you get that pain, and your doctor will probably say to you, you've got sciatica. Basically, you're going to need a lot of painkillers, and you're going to have to take it easy with your activities, obviously. But the key thing you must know about sciatica is you need to be sitting. Anytime you sit down, you need your hips to be higher than your knees. So what you do, you get 2 or 3 proper sized pillows or cushions anytime you sit down. Now that alone is the practical solution. You're going to have to do that for 3 weeks in a row. You'll notice that by day 3, day 4, the pain's probably gone, all right? But you still have to continue that method for about 3 weeks. If your pain lasts more than 3 weeks, well, you need an MRI scan. It's a magnetic resonance imaging scan, all right? Now, of course, if it repeats itself every now and then you still have to go and get a scan anyway. If you get this sciatica business happening on both sides, so your left and your right buttock going down your legs, well, that needs automatic admission to hospital, okay? Because that's a significant problem, and you can't tell what the cause is until you get yourself admitted and check it out. But the most cases, it's all about one side affected. And no matter the amount of painkillers you take, you might find yourself heading nowhere. But as soon as you start this method, sit on 2 to 3 proper sized pillows, you notice relief, literally within 3 to 4 days, generally. I've not seen a single patient try this and it never worked, in my experience. So, yeah, if that happens to you, try that. Okay?